So in this video, I will demonstrate or show how to position your PSMs, ECM, and all your arms around the task that you're trying to achieve. So let's assume this is the anatomy you want to work with. You have to keep in mind that these robots were designed to work inside the patient, so about 10, 15 centimeters from the RCM point, which would be on the surface of the patient, to the task. So if you position your arm like this, just above your workspace, the problem is you will be running out of space and hitting mechanical limits on some of the joints. This is true for this joint, this is true for this one, and that one as well. So the first three joints, what we want to do is kind of position everything close to the zero position. You can see here 0 and close to 0 here. And then you want to bring the arm so that the tooltip is close to the center of your workspace. So in this case, I'm going to bring it this way. Now you can see in this case that the PSM is kind of colliding with everything. So you want to approach it from the side. The best way to approach the side without being away from that 0 limit is to use the setup joints. So now I'm going to go in this way. I'm going to do the same thing for the ECM. So the camera manipulator is the same thing. You have an FCM point. It should be about where the patient is, which is, let's pretend around here. And I'm going to bring it there and I have this. And again, my ECM now is fairly well positioned, so I can move in all directions without having on the joints. I'm going to do the same thing on the PSM here. What I do is bring the OCM point around the surface point, orient it, and now I have 3 arms, and you can see how the OCM points are close to the surface in this here. And I can move my arms as much as I want. I won't have any trouble hitting mechanical limits when I'm trying to do it. Then the last one, the PSM3. For people who have a third PSM, it is often a little convoluted to get it. And it usually comes from the side, slightly underneath either your right PSM or left PSM. Like so. And you can see I still have a little bit of motion and work in that one space. So that's a somewhat correct placement, and it will give you more freedom and avoid joint limits. One of the problems with the DVRK tool operation is we don't handle joint limits very well on the wrist. So if you want to have a view where you have your tools like this is the best example. If you have a view where the PSM come from the other side, you'll likely start twisting your wrist away and trigger some errors in our kinematic.